We have Seattle's favorite dermatologist on, Erin Moore, also
You're
at
very flattering.
Skin MD Seattle. So say hey, tell us what's up.
Yeah, it's a Saturday. It's nice outside, but here we are recording for you guys. I know it's sunny in Seattle. March. It's like the lamb came. So I'm really excited. But I know I
Kinda.
don't really
It's
like
like
I don't like sun actually that much, but Seattle sun's like perfect for me.
you're a dermatologist. Do you like have like a sunbrella? Like what do you do?
I have multiple sunbrellas actually.
Figured.
I carry an umbrella like every single day of the year, and people will actually will tell you that they've seen me out in the wild with an umbrella in like July. So yes, I do. I carry
You
an
use it more
umbrella at
for
all times.
sun than rain.
100% yes.
Isn't that
Yes.
crazy? There's so many posts like you
Not
see
for
on
me.
Seattle, like nobody in Seattle uses umbrellas. They must be a tourist if you're using an umbrella in Seattle.
Well, I
So you use
mean,
it
I
for
don't
sun.
use an umbrella for rain, but I use it for sun quite frequently.
Makes
Yeah.
sense. So yeah, you're a dermatologist. Like why do I have a
hmm
dermatologist on? It doesn't really matter. I can have
I know.
anyone I want on. To be honest with you, there's crossover topics we're gonna hopefully get into that kind of go and coincide with dental, oral stuff, oral surgery even, and things like that.
hmm
I also asked Reddit. Like I went to Reddit and I said, what are the top 10 most like dermatologic skin questions people ask? And we're gonna hopefully get go through those as well, which I
Oh
think
my
are cool.
gosh, I'm gonna be quizzed.
It's not really a quiz. We're just
This is like
chatting, right?
I should get CME credit for this.
Everyone should get CME credit for these things, I swear.
I know. Not getting
So
paid,
you're
so I should at least get something. So.
I know. So that's the other thing. I wanted to make sure everyone knows this. Like you have a pretty cool Instagram account where you show like everyday stuff. I think like that people can do on their own, and then obviously go out and get some procedures. Like we'll get into like lasers and
hmm
things like that that you think are helpful or not. And some of the stuff that you think are myths, like TikTok trends. I don't know what you think that you found that patients ask you. I'm sure you get a lot of weird questions.
Oh my gosh, all the
Right.
time.
And
Yes.
so,
Oh
yeah.
yes.
And so
Yeah.
I'm going to try to buzz through those too. And hopefully we get to some of those myths and stuff that might be even true. Cause I'm curious. I mean, I make my own soap. I mean, I'm just weird, but and so I've never used Botox on my face. I've used it on my armpits one or twice now, twice now.
Twice now. I mean, it's
That's,
kind of
it is
amazing for the
so,
armpits, isn't it? It's
it is,
amazing.
I was like, I did it like, was it last year? I'm like, I should have done it like years ago. Like it was like the best thing ever.
It's sort of
So
life
that's the only
changing.
place
Yeah.
I've done it, but it's like, I've never used it on my face and we'll get to that too.
Well, I can tell. I can tell. Let's just say I can
Yeah, I
tell.
know, right? See, I
I
got the
can tell.
lines.
I can tell.
Yeah, I
Maybe
know.
we need to
Oh, I
get you in
know.
for a little Botox.
Maybe. Yeah, I was trying to fight it for a long time, but we'll see. We'll see.
I
The thing
kind
I
of
wanted
like
to
that
get
rugged
to,
look.
kind of, for a little while. I don't want to get like Robert Redford though at the end, or the Crypt Keeper from Tales of the Crypt. Um, we're get the stuff you put out there. Like it's a lot of like cool everyday stuff. I think that people can get a lot out of, and I get stuff out of it. And I wanted to note for the people like watching or listening, like you're not sponsored by anyone. Like you're putting out stuff and recommending things that you think actually work, but you're not getting paid to do that. So I think that's a big
No.
deal. Like there's so much stuff out there that people get products sent to them or something, and then they
Mhm.
get paid to do these things, and it doesn't really, you know what I mean?
Yeah, I will say, I mean, sometimes I get some samples, but it's not the expensive ones. And I definitely buy, I spend more money on my Instagram account than I get from it. I don't get anything.
Right.
And I definitely buy things specifically to try them out for my patients and for Instagram. But yes, I'm not sponsored by anyone.
Got it. Awesome. Do you want to get into some Reddit questions?
Yeah, ask me,
Let's
ask
do it.
away. Yes.
Just so you
Okay.
guys know, like listening or watching, like I haven't prepared her. Like these aren't like things that we've chatted
I'm
about
not
even.
prepared
So
at
like
all. Yeah.
this is gonna be fun. This is gonna be fun.
Yes.
Because I have a lot of these same questions,
It's
honestly,
like
and I think a lot of people
Jeopardy,
do.
right? Like
Kinda.
Jeopardy. Yeah. Okay.
The Alex Trebek Jeopardy, not the other dude.
Yes. Yeah.
I try to watch it with
I
the
like
other
the other
guy,
dude too.
Jennings or whatever. I don't know. I'm not a Jennings fan. I don't know. Maybe it's the lisp he has. I don't know. I can't get into it. But so here's one. So number one. So these
Okay.
are like the top 10 most asked questions on Reddit for kind of like
Okay.
derm stuff, skin stuff, and I think some of this stuff I even have notes on that I wanted to talk about. Number one, acne that won't go away even in adults. Like adult acne. Like I get it sometimes. I'll get like a pimple like
Mhm.
randomly. And it's like for me when I
Yeah.
get one, it's like I can tell something's happening and it's like a
hmm
little sore here. And then like it'll be there for like a couple weeks.
Yeah.
And then at
So
some point, like, what do I do? Like, I don't know. What do you
yeah,
do
so
with
it's
that?
it's kind of a myth that acne goes away in adulthood. I mean, the studies show that like 30% of people have acne into adulthood. So we don't really know the exact reason why people have acne. There's a lot of reasons, like a lot of things go into it. It's hormonal, it's environmental, stress. I mean, I'm sure that there's a huge component of our diet with processed foods, but there's not a lot of studies that show like hard data that you can change things. So, I mean, with food and diet, there is a suggestion that high glycemic index diet, meaning like things that raise your blood sugar really quickly, which typically aren't very good for you anyways, cause acne, and stress kind of has a cortisol response. But in terms of why people get it for their entire life, we don't really know the answer to that. But it's a myth that it always goes away. In terms of what you should do for it. Now, I mean, some people have it very severely and they should probably seek care from a dermatologist. What you can do if you're not going to the doctor, there's a lot of things that are over the counter and they typically have the same components in them. They either have salicylic acid, benzoyl peroxide, or adapalene, which is an over the counter like retin A. I usually recommend people start with salicylic acid wash and maybe gel because that's gentle, because a lot of times if you throw too many things at your skin for acne breakouts, it actually can make it worse or it gives you a rash and acne. So salicylic acid tends to be a little gentler than benzoyl peroxide and much gentler than adapalene. But looking for things like that, there's a ton of over-the-counter products. Cetaphil has their whole gentle clear line, which has like low concentrations of salicylic acid and benzoyl peroxide. So starting with just a wash and then maybe a salicylic acid gel, like a 2% or lower. They even go down to like 0.5% as like a spot treatment. And then actually seeing a dermatologist for some direction as to sort of what products are going to be good for your skin, because the acne products that you buy over the counter can be really irritating to the skin. And I see people come in with their skin all rashy because they've tried so many acne products and they still have acne and now they have a rash on top of it. So kind of just starting out with just one product and low concentrations is usually what I recommend.
So are you saying like do it like a preventative thing where you're just doing a wash every day or every couple days? Like, so I'm a guy.
You
I don't
know,
like have this huge prep routine. Like I don't do like a bunch of stuff at night and like some people do like this whole routine before they go to bed. I mean, I make my own soap. I wash my face and I don't know. I don't do a ton, I guess. I know people do a lot of things. Are you just using that every day then, every couple days? Like if you don't have huge breakouts, but you want to prevent like that. Or and then I
oh
also
my
see
gosh.
like I see a lot of teens in the office and they have these little
Mm,
patches on their face for what are those like about?
yes. Okay.
Like, are those
So
good? Like what's going on there?
it like honestly makes me cringe when you say you make your own soap. When anybody says they make their own, I'm like, ugh. That's typically not. I mean, we have really good products out there, and they are usually better than what you make yourself. That said, I typically recommend using a salicylic acid wash a couple times a week for adults, actually, because it helps with exfoliation. And if you don't exfoliate, you're going to get congested. The one that I prefer or use frequently is the CeraVe SA Renewing Cleanser. It's a very gentle salicylic acid cleanser, and I use it like a couple times a week to help prevent congestion and acne breakouts. And that's something that anyone can use probably every night. I do think it is important to wash your face every single night. You don't have to necessarily use a cleanser in the morning, but using a cleanser at night is important because it gets kind of like all the pollution and oils off your skin. But it is really important after you wash your face to put on a moisturizer. So you
I
are
do
correct.
that. I also do that.
Many, okay,
I don't
good.
make my own
I mean,
moisturizer. I use
yeah.
Kiehls or whatever. I don't know what I have right now,
Oh
but
my
yeah.
gosh, that's the funniest thing ever because men like always use Kiehl's and I don't know what it is. I don't know if men like if Kiehl's like markets to men. Every single man that I ask them if they use a moisturizer, most of them don't, but the 30% that do, they're like, yeah, I have Kiehl's. So I'm not sure how Kiehl's has gotten to
It could
all
have
the
been a
men.
gift. Like maybe like
I've
someone I
I've
don't know,
like
maybe the marketing.
never in my life bought anything from Kiehl's. I've never gone into a
I don't
Kiehl's
know.
store. So I'm like, how Kiehl's has the market on men, and I think their products are probably great. But
Yeah.
that's, I mean, I think so I usually
Well, they have a little
recommend,
section at Nordstrom with Kiehl stuff for guys. Like that's how I found it. And I don't know.
that's
I don't
what
know.
it
So I
is.
don't know.
Okay.
I don't
I
know.
know. I mean, now I'm going to start getting like Instagram ads for Kiehl's because I'm talking about Kiehl's with you because my phone is like
That's how it
recording this.
happens.
So I
That's how it
know.
happens. Yeah.
Maybe I need to buy some Kiehl's. What Kiehl's products should I get to try out? Do you
I
have ones that you
literally only
like?
have two. I have an eye cream, and I saw a post that you
Mm.
did that eye creams don't really work, but you still use them.
Yeah.
There's an eye cream and a regular
Uh-huh.
moisturizer. Yeah.
Well, good. I mean, I'm not saying that eye creams don't work. They hydrate the skin, and some of them have like certain things in them that might help with anti-aging, but they don't do what most people want them to do. Like most people want, like basically people want a
Wrinkle reduction
facelift. Yeah, a
and
facelift and a
brown
cream, and that's
spots. I
not
don't
going to
know.
happen. Yeah. Well, they
Yeah.
want they want the bags to go away. They want the
Yeah.
crinkliness to go away.
That's
They
why we
want
drink
this
Celsius.
color to
Get the
get
bags.
better. I know, I guess. I know. But a cream is never going to do that. So a cream is just going to give you hydration. If it has specific things in it, like sometimes there's creams that have pigment reducers, or some creams have retinols in them, and that, if you can tolerate it, might help with wrinkles. But for
Yeah.
the most part, people are disappointed with eye creams when they actually need an eye cream because they expect it to do much more than what it would ever do. I mean, it's if I tell people that if there was really a miracle cream that's going to give you like a facelift in a bottle, Oprah would have put it on her favorite things by now and everybody would know about it. But she didn't, and everybody's getting facelifts and blepharoplasties and that sort of thing. So clearly there's no cream that actually
Right.
does what most people want it to do. That doesn't mean you shouldn't use one because the skin is very delicate and hydrating it is going to give you some benefit and make it look better, but it's not going to be dramatic.
Makes sense.
So,
But the Kiehl's
yeah.
one, I don't know, it feels smooth. I don't know, it has a
You don't
pleasant
feel smooth?
smell. It does. Like
Oh, it
right when
feels
you put it
smooth. Oh,
on, right
yeah.
when you put it
Uh-huh.
on, and it's not like oily.
Yeah.
I don't know. Whatever. I
That's
don't get
good. I
paid by
mean,
Kiehl's or anything, so I just use it.
I think that whatever product you're going to use is the best one to get. So if you like Kiehl's, you like the smell of it, you like the feel of it, it's going to make your skin better. So I typically just say like, is the product you're using giving you the results that you want? And if the answer is yes, then I would keep using it. If the answer is no, then we need to sort of say, well, why is it giving you the results you want? Is it because it's not the right product, or the results you want are never going to be given to you by a cream anyways? So.
Right. Yeah. I mean, we're talking about topicals here, so there's only so much that they can do, I'm sure.
And
Let's see.
I
Let's
mean,
see.
that is true, but I mean, TikTok
I mean,
would have you think
over the
otherwise.
counter topicals. Yeah.
Well, even
True.
prescription and ones that you pay, even like plated exosomes that you pay $300 for, are still not going to give you more volume or take away wrinkles that like or work for sagging. Like people go, I want a cream that's going to go like this. I'm like, there's no cream that's going to go like this. So,
What about little
but
St. Ives?
oh, the apricot scrub? Actually, yeah, no. I mean, they still have that. They still have
You
that.
know,
Actually, I bought some to do like a reel and it completely flopped. Like nobody thought it was funny. It was like I was like, let's not bring back 1996, and everybody was
I know
like,
you could have brought
what?
back like Studio Line
They're
from
like
L'Oreal or something. But yeah.
1996. I'm like, they're like, because half my people that look at my stuff are like, don't even know, like they weren't born in 1996, and the other people were like, not they weren't aware of 1996. So I don't know, but yeah, so they still have that, and it actually has like little pieces of walnuts in it. I don't usually recommend using physical exfoliation like that apricot scrub very often, if at all, because it can be pretty harsh on your skin. Using it once or twice,
Just use it on
like,
your feet or something, not on your
yeah,
face.
I mean,
I
using
don't
it
know.
on your actually, yes. I mean, people definitely people could use it on their feet. But I actually had a patient come in the other day who had seen some trend on TikTok where you were supposed to use a pumice stone on the dry skin on your face. I was like,
Uh,
what happened to your
on your
forehead?
face?
Yeah, he
Yeah,
had
no.
pumice stoned the dry skin on his forehead.
Ugh,
It didn't
that's
look very comfortable.
looks like road
So
rash.
it looked like rash. I thought he'd fallen, but he'd actually done it to himself. So
Right,
yeah,
right, right. Here's
yeah.
another one. Let's see here.
Okay, these are kind of fun.
Yeah, these are fun actually. Oh yeah. Okay, what are we on here? Oh, okay. Oh, number two. Was that just number one?
This is
Oh
number
yeah.
one. Wow.
Oh my God. Number two. Oh, this is a But the second most common questions are on like Accutane, isotretinoin,
Got it. Okay.
dosing myths, side effects. Like people ask a ton of questions on this stuff.
Yeah. I love Accutane. Actually, I did a recent reel on microdosing Accutane, and that went off the charts because people, I don't know, when you put microdosing on a reel, they're like, "Oh my God, what are you microdosing? Is she on a
Mushrooms?
GLP-1?"
No, it's
Oh
Accutane.
no,
It's Accutane.
that didn't even come to mind, but someone actually
Yeah.
commented that. They're like, "I thought you meant mushrooms." I was like, "Oh gosh, no."
Yeah. The
That I
terminology, the
that
terminology.
did not enter my brain, but yes. So
Yeah.
Accutane is an amazing drug. It works amazingly well in teenagers or even adults who have very severe acne to cure them of acne. I tell people it's the only medication I have that I can guarantee that your skin will be clear in probably 3 to 4 months. And that's when we're going for like a cure with the higher dose. Now I typically don't do the high and dry, meaning I don't try to like kill you with Accutane. I don't try to put
Make you
too
bald.
much. I
Yeah.
don't, well, it's not going to make you bald. Some people do experience hair loss. All of the side effects for Accutane are dose dependent. So the more you're on, the more side effects you're going to get. And those are primarily like dry skin, dry eyes, dry mouth, dry lips, dry nose. Some people can get hair loss, a lot of sun sensitivity. So those are the big side effects, but it works amazingly well. Like it really turns people's skin around. Now you can dose it in like small doses, and I have lots of adults and like men and women who take what I call like a microdose, like which usually ranges from like usually 10 milligrams, and they take it 1 to 5 times per week, sometimes less than that. And basically, it makes your skin amazingly clear. Like you basically have zero breakouts ever. And the side effects are typically none because it's such
Yeah.
a low dose that you don't have any. I mean, if you take one pill a week or one pill every couple weeks, like say you have hormonal breakouts during a certain time of the month and like during your cycle, you take 1 or 2 pills, you're not going to have any side effects. Like it doesn't really even doesn't make your skin dry, it doesn't make your skin sensitive, it
Nice.
won't
Do you have
affect
to check
labs. So
LFTs with microdosing?
no, and I actually
Okay.
rarely check liver enzymes with regular dosing.
Okay.
So they used to, like way back when, have people
Yeah.
get labs every single month for Accutane,
I
and
remember
they
that.
realized that like they had a whole bunch of teenagers that had like basically normal labs. So they said now the recommendation is to check it once during your treatment course. And I typically do that, but if it's something that is going to prevent someone from taking Accutane, like there are some kids are like deathly afraid of having labs, I don't make him do it. My son
Okay.
went through an entire Accutane course and did not have one lab draw, and he's still alive and fine. I don't think you definitely don't have to have it every month. And if you're on microdosing, we never do it unless somebody's a very heavy drinker. So if you're a heavy drinker and you're on maybe a daily dose, then we'll check it every once in a while, because alcohol obviously has a cumulative effect on your liver, and so if you
Hmm.
are drinking alcohol heavily, which many people aren't aware that their drinking is heavy, then we will check your labs intermittently.
I remember I took Accutane only a very short amount of time, like right when I got into dental school. This is like in the
Hmm.
90s. And
Yeah.
like you said, it cured me. Like I was getting these weird breakouts and I never had any
Hmm.
since like that. Like I'll get like a
Yeah.
solitary one here and there, but nothing like I was getting before.
Yeah. It's
So it was,
amazing.
yeah, it definitely worked for me.
I offer it to people. I mean, I prescribe Accutane probably every day. And I
Right.
try to make
Is
it easy for
minocycline
people.
still a thing?
Uh,
Is minocycline
Tetracyclines
still a
are
thing?
still a thing. So
Yeah.
tetracyclines are a thing. Typically, we use doxycycline rather than minocycline just because there's quite a few more side effects with minocycline than doxycycline. The goal with antibiotics for acne is to use them as sort of a jump start to get someone clear and then transition them to things that are not antibiotics, because if people are on antibiotics for long periods of time, it can affect their other normal bacteria. So the normal bacteria in their gut or in their respiratory system, probably in their mouth. And minocycline is actually something we use for infections. And so we don't want your body to become resistant to doxycycline because it's something that's used frequently for staph infections.
Yeah. I
So
still
it's
see
around,
teeth
but
when I remove teeth with the staining from
yeah.
that. Isn't that crazy?
So that's typically why we don't use minocycline, because not only can it cause staining of the teeth, that's if it's used in somebody that's young.
I know. Exactly.
So
You see it in the
typically
roots.
a dermatologist would know not to use it in somebody that's too young, but it actually in anyone can cause like a kind of a graying of your skin, and also it can cause weird like deposits of darkness on your shins, and that's irreversible in many
Oh,
people. The dark deposits on the shins are irreversible. The graying of the skin is not irreversible, but it's I've seen people with gray skin on minocycline. They come in and they don't even realize that their skin looks gray. And we take them
crazy.
off the minocycline and they're like, oh my gosh, I never realized how my skin looked so gray. So I typically don't use minocycline unless somebody is already on it, or I don't know. I try not to use minocycline. I would use doxycycline first.
I also see, and just speaking of the minocycline, doxycycline, in those patients, like let's say I take some wisdom teeth out, and I have examples of this too, where I take the wisdom teeth out, and you can see on the roots the dark staining of the roots from likely
Mm-hmm.
some sort of doxycycline or something like that.
Mm.
And what also happens is honestly the bone around it in the mandible, when you expose that bone to remove the wisdom tooth, is yellow. Different. It's a darker like yellow
Interesting.
versus more ivory white.
So you
Yeah,
would
it's different.
say
It
don't.
definitely
So
changes.
you would recommend not using the tetracyclines. They probably are
I
bad
mean,
for teeth.
those patients were younger, likely when they were on it, so they weren't ideal cases
Okay.
to put on that medication at that period of time.
Okay.
So I'm not sure if it has to do with that, but that's definitely a clinical thing that I see and I've seen.
Interesting.
Not so much as much anymore, but I've definitely once or twice a year I'll see some teeth like that. So
Interesting.
yeah, it is interesting actually.
More
Here's one, number
education needed.
3. I've been performing full arch dental implant surgery since 2012. I started back then with Nobel implants and I continue to use them today. Getting consistent results over time and seeing these restorations in function over that length of time has basically strengthened my use of the product. There's over 100 implant systems out there. I just choose the one that's been the most consistent for me.
Number 3.
Education. We need CE here. Skincare routine confusion. All right, so this is number 3. Skincare routine confusion. Like, what order do I
Okay.
use these? I have retinol, vitamin C,
Yeah.
acids. Like, is there an order? Like, does it matter? Like, mix them up?
So it does, I would say it does matter. I typically recommend always if you have a medication. So if you have a medication, like a prescribed medication, you use that first. So it soaks in first. And then from there, you would go kind of like thinnest to thickest. Now,
Oh,
people tend to use maybe too many products, but so like thinnest to thickest, meaning like you put on your medication and then maybe you use, everybody loves to use a serum. Or like, that's like the most common thing. They're like, I use a serum. I'm like, well, what does your serum have in it? And they don't know what their serum has in it, which you should always
serum,
know
dude.
what your serum
Sounds
has in
cool.
it. You should know what your products are doing for you, because a serum it could be anything. So, but
True.
something that if it's in a serum, like a liquidy sort of base, that would go next. And then like if you have a sunscreen, I always recommend putting on your sunscreen last. So that's going to be last. So in the morning, for example, I'll put on a rosacea medication. Then I put on it's actually a peptide serum. Then I put on a vitamin C. Then I put on my tinted sunscreen. And that's the last layer. So I put
Wow.
on 4 things, and the sunscreen's last, the medication's first, the serum is second, and then I actually have a vitamin C that's sort of a light moisturizer. So I have 4
That's
steps.
awesome.
And then
I
if I
use
was gonna
my,
do
yeah, I use, go ahead.
makeup, I would put that on last. But I
That's a
typically
lot of
don't put
things.
that much makeup on. Yeah,
God,
I mean,
you ladies, man, I don't know. You do a lot of things. I guess guys do it too. I use my Ratchet
some guys
soap and I
do.
put my Kiehls on. I just jump
As
out the
long as
door.
your Kiehl's has a sunscreen in it, then I'm happy.
I don't think it though.
It should. So I had a patient recently this week who gave me a really good way to tell people. And her skin is gorgeous, but I think she's 54 and her skin's
Hmm.
amazing. And she said, I tell people that they need light protection. And that is what people need to think about. Because I ask people, do you use sunscreen? They're like, oh, when it's sunny out. And that's
You
good
mean
if
like
you
blue
want to.
light? Like blue light
So yeah, so if
or
you want to
like
protect yourself, yeah, so if you want to protect yourself from aging, you need to wear sunscreen every single day. And you need to wear a sunscreen that has a UVA filter, which the only really good one that we have in the US is zinc. It's got to be 10% zinc. And even for the guys out there, it needs to be tinted. Now, this is if you're trying to prevent aging, because aging is caused by not sunlight. Well, it's caused by sunlight, but it's caused by UVA. And UVA is the SPF on your bottle doesn't tell you anything about UVA because that's the UVB coverage. So you need UVA, which is zinc,
Okay.
and you need tint. And the tint protects you from visible light and blue light. They call it high energy visible light. If that makes you feel like it's damaging your skin, it's high energy. So the blue light and visible light
Like from
actually,
computers. You're talking about like
yes,
from
yeah. So blue
computers,
light, it
phones.
penetrates
I don't
really
know.
deep. Yeah, yes, yes, all of that. So people that sit
Ugh.
at home looking at their blue light all day, I mean,
Doom
you wear
scrolling.
blue light glasses. So why do you think that blue light is not damaging your skin? It's not going to cause skin cancer, but if you are concerned about aging, you
Right.
need something to protect your skin from that blue light. So that's why
I
I
mean, how many
wear
people are on their phones like this close to their face, like looking through stuff,
I know
especially in
exactly.
bed,
I'm
like you're on
on,
your side, like kind of scrolling before you go to bed.
yeah. So I
It's
wear
crazy.
10% zinc. I wear and that's why they say don't have it. Don't take your phone to bed. That's why you should not take your phone to bed. Avoid blue lights after before bedtime because you probably don't have your sunscreen on. So yeah. So if you want to do the
Interesting.
most anti-aging regimen, you want to wear a sunscreen that's 10% zinc and tinted every single
Is there a
day of the
brand
year.
that you recommend that for guys or whoever, like anything
For
simple?
guys, oh my gosh, for guys it's hard. I mean, I say whichever one you like the best is going to be the one that you're going to wear. I
Yeah.
do think that the Dermatology broad spectrum SPF, I think it's 40. That's a good one. It's not
So the
tinted just
brand is
because
Dermat.
yeah, but it's not it's like without all of the vowels. So it's
Okay.
DRMTL.
DRM.
Yeah, and you can get it on
Okay.
Amazon,
Okay.
but it does have at least a 10% zinc. It's pretty cosmetically sensitive. It's not tinted. Some guys don't like tinted, but it's going to give you that 10% zinc, which the UVA is actually is going to have more aging than blue light and visible light. So protecting your skin against UVA is more important than the tint.
I will look that up
But
right
yeah, that's a
after
good
we
one.
record.
Yeah. There's a lot of them out there though. You just Elta MD UV Daily has a good non-tinted SPF. It's like 9% zinc. So, but yeah, so UVA, you want to make sure you get your UVA coverage. But that's only if you're not worried about aging. I just get a lot of people who are worried about aging. But if you're not worried about aging, then the
I mean, I'm
SPF
getting
on the
more worried
bottle.
about it now that I'm actually aging. So, yeah, you don't worry
Well,
about it when
I
you're
tell
young usually,
people
but
the time to worry about it, the time you should actually do something about it, the earlier you do something about it, the easier it is to stop. Like it's much harder to reverse aging than to stop it. And people don't
mhm.
like they kind of get offended, I think, sometimes when I tell people that, but I'm like it behooves me to like not tell you that because I actually make money on the things that like reverse your aging, like lasers and Botox and all
Right.
that. But I would actually like you not to like have a chest that looks like leather. Like that's really hard to make go away. So put some sunscreen on your chest or cover your chest. Like it ages you. Like it looks
Right.
bad. But people don't I have to say it in like a sort of I don't know. I try to be sensitive about it and just be like,
Tough
you're
love. That's fine.
yeah.
You'll
Well,
be all right.
yeah.
I'll walk it off.
Then I get
Soft
really bad
diet.
I get really bad reviews then.
That's true. You might. Yeah. Here's another one. Let's see here. Number 4 on Reddit. Hair loss and thinning questions. Shedding phases. I don't know. Minoxidil versus finasteride. Like, do you
Oh
get questions on hair loss? Or
my
is that
God. That's
not
like
your
it's
jam?
like the no, I mean I do a lot of hair loss and
Okay.
it's like the most it's like at the end of a visit I'm always like, so are there any other questions? And the number one is hair loss. And it's a very big topic. So
Yeah.
typically I have to say if they haven't like told me about it at the beginning of the visit, I have to say, well, I have a whole questionnaire I have people fill out. And so we do a whole workup on hair loss. Now, the number one cause of hair loss, I mean, for men, it's a lot easier. It's a very short conversation. So for men, I always say for men, I recommend finasteride and minoxidil. If they're only going to use one of them, I say use finasteride because finasteride or Propecia will keep you where you're at. It's like the studies are very robust. It's been around for a long time. It will keep your hair like from falling out. And
These are
the
daily
falling
pills you take?
Yeah, I mean, if you
Okay.
miss one, it's like it's a long-term thing.
Okay.
So the finasteride keeps you where you're at, and the male loss component is very strong. And so men, if they just take minoxidil or Rogaine, the oral form of Rogaine, they will still lose hair, and eventually the loss component will overcome the growth component because the minoxidil can only stimulate hair follicles that are not what I call dead or miniaturized.
Okay.
So men
Right.
have a very strong miniaturization component. So your hormones are making for many men, the hair follicles die. So the finasteride prevents that to a certain extent. And then if you want more hair, the minoxidil will stimulate that. For
Interesting.
women, it's very complicated and there's a lot of emotions involved. And so and it's real. Like I
Yeah.
tell people, men and women, like none of us are getting out of here with a full head of hair. Like your hair is going to be thinner when you die than when you were 20. And there's nothing we can do about that because I get people who are 80 years old coming to you for hair loss and people are healthier now. So they're like, my hair, like, what's going on? They also have this whole like, they are comparing themselves to people on social media who have fake hair. Like,
Right.
so there's these like women, especially in their 40s and 50s, and their hair is thinning because we're getting older. I say we because I'm in that same category. And then they see people on social media who have hair extensions and it looks gorgeous. And they're like, why do I not
Right.
have Disney princess hair? I want Disney princess hair. And it's not real. So there's that. And then the other big thing that we have that's come into sort of play more recently is the GLP-1s, which are like
Right. Yeah. Yeah.
highly unregulated. And I think they do amazing things for people, but people can get them very easily and they're not told when they take them that they have effects on their body that appreciate. And hair loss is one of them. So
Oh,
anytime
really?
people oh my gosh, yes. So people lose weight. I mean, they lose tons of weight, they lose 20, 40, 80 pounds in a year. And that's like, I mean, your body goes, when you are losing that much weight, your body goes into this starvation mode and it conserves its energy for the things that it needs the most, your cardiovascular
Or
system,
yeah, organs.
your
Yeah.
your organ system, and it doesn't give any nutrients to your hair, so your hair falls out and it's delayed, so people don't really realize it. So there's about a 3-month delay before they get this hair that just starts all falling out, and it's really
Crazy.
distressing because they want to be on this GLP-1, but they also don't want their hair to fall out. But typically, I mean, I see people that are on GLP-1s that just look incredibly malnourished because you don't have an appetite. And if you're not extremely deliberate about your diet, you are going to be malnutrition because you just aren't eating as much. And so if you aren't concentrating on the nutrients, then you're just eating a bunch of
And you're
crap and
losing
not very
muscle
much of
mass
it.
too, aren't you?
Oh
Like
my
with the
gosh, tons of
GLPs,
it.
like
Yeah.
you're
So
like you can work out, but you're not gonna really see like the results you're wanting, I think, too.
only if you're being deliberate about your diet. So you just have to I mean, so the GLP-1s have really brought in a bit like so much hair loss. Like everybody has hair loss because of the GLP-1s and it's
Well,
a
it's good
really
for
hard
business. It's good for
conversation.
business.
Well, I guess, but it's a hard conversation in the sense that I have to tell people that their hair is probably not going to stop falling out until they stop losing weight because it's just a biological thing that when your body feels like it has limited resources, it doesn't give it to your hair and your skin and your nails. Like your skin looks, I mean, I see there's a lot of skin sagging too. So it's a hard thing, but there are medications. I mean, I put women on intake Propecia as well. They can take minoxidil. Minoxidil is not as for women, we can't use as high of a dose because they'll get hair growth other places that they don't like. So men don't notice that as much. So,
You could
but
rock a
yeah,
unibrow. I think you'd probably could rock a unibrow.
I actually got my eyebrows done today, and during the session, like it was like I looked like Bert or Ernie or one of those two. I kind of had the unibrow look. It's not well, they're I mean, most women actually like so minoxidil actually does make your eyebrows and your eyelashes better, which most women and
Yeah.
some men like. It's more
Yeah.
like facial hair or hair on top
Yeah,
of
I
their
know.
hands or arm hair. So, but
Right.
yeah,
Got
yeah.
it.
So, but
Here's
hair
here's
loss
number
is
5.
huge. Okay.
I didn't know it was that. I didn't know it was that big.
I
I
know it's
worry about
huge.
it. Like I always like ask my stylist. I'm like, "How's it look up there?" He's like, "Oh, it looks all right." I'm like, oh, "Okay." Like you
I
tell
mean,
me
your
if there
hair
was
looks
something
pretty
going on,
good.
right? Yeah, it's
I
hard to
mean,
tell. Like I feel, I don't know.
for men, I I have a very low threshold for putting men that ask about it on hair loss medications, as long as they're aware of sort of like the potential side effects, which usually are none. I will
Hmm.
put men that are 18, 20 on finasteride and minoxidil, because if you do have a very strong loss component,
Right.
the sooner you start, better, because it's really hard to get things back. And as you get older, I tell people when they're losing their hair, when we're trying to get their hair to be better, that stabilization is like that's that's good. We've achieved something, because we expect things to get worse as you get older. And so
And part of that
if
is
we
genetics, like you said. Like
yeah.
you're set up for that.
So if you're worrying about your hair, I would say start the medications early, because
I
the
hate
earlier you
pills.
start, the better you'll be off.
All right, maybe I will. I'll get that in the dermatology zinc thing.
Yeah.
Let's see. Oh, this is a big one. Number 5 on Reddit. Sunscreen questions. We did cover some of this, and
Okay.
they're like, "Do I need it?" There's a question. Do I need it indoors? And we kind of covered, I think, that too. There's like mineral versus chemical sunscreen. I don't know the difference.
So, I mean, so chemical, so the difference is the way that they work and how they block the sun. So mineral sunscreens, I mean, they're actually a chemical too. And oftentimes the two sunscreen, they have a mixture. So they'll have some mineral and some chemical. What chemical sunscreens do is they absorb the UV energy, the light. So they absorb it, and the mineral ones reflect it. So that's why the old mineral,
Hmm.
like the quintessential mineral is zinc oxide, like it's white, like it looks like the white nose. And so what it
Just
does
put a
is it
yeah.
reflects, yeah, so it reflects the UV. So I tell people the benefit of mineral is that well, technically you still need to reapply it. The mineral probably has greater stability, because if you can see it on your nose, like if it's like thick white on your
Visible.
face,
Yeah.
it's it's still working. Whereas the
Right.
chemical ones have a tendency to get used up, because they absorb the energy and they get used up. I typically recommend using something that's a combination, so like a 10 to 12% zinc with some chemical filters in there as well, so that so it's more cosmetically sensitive. They
Is there
have
a minimum
done
SPF that you recommend, or does it matter?
So the SPF is so that's a big one. I also did a reel that I thought was super funny, and my daughter thought it was funny, on SPF 67, like 67, because people tend to think that the higher SPF means that like it lasts longer, or I don't have to put on as much, and that is a myth.
Yeah. Okay.
So the SPF scale is logarithmic. So that means that an SPF of 30 blocks, like I think it's something like 92% of the light, and an SPF of 50 is like 96. So there's not that
Okay.
much, you don't get that much benefit from something that is a higher SPF, as long as you have the minimum of about 30. So minimum of
Okay.
30, but they've actually made it's now illegal, though there's like a transition period to have anything, so that to have anything labeled SPF higher than 50. That's why you have a lot of labels that say SPF 50 plus plus, because they're saying like it is higher, but it's now illegal to say like
Because
there
it's
should not be.
misleading, right? Is that
It's
why?
misleading, yeah. So it
Yeah.
misleads people into thinking that they're getting something better by saying, like, charging more for SPF 70 than SPF 40. There's no difference between the two. You still have to, they still don't last any longer either. Like you still have to reapply them the same amount as you would an SPF 30 and an SPF
Interesting.
70 have to be reapplied with the same frequency. And people grossly underestimate the amount of sunscreen they need. I did a reel on this too, which was very popular, because I had a shot glass and I was in a bathing suit. So that one was popular, where I put like the amount of sunscreen you have to use on your body if you're in a bathing suit is the shot glass. And that's a lot. Like that's an
Yeah. Yeah.
ounce. And if you think of a sunscreen bottle, it's like maybe 6 to 8 ounces. So if
Right.
you're in Hawaii on the beach for 8 hours, you're going to need to use a 6 ounce bottle of sunscreen every single day per person. And
Wow.
that is why people still like they come to you, they're like, well, I use sunscreen, but I still get sunburn. I'm like, well,
You
I
didn't
think
use
it's not
enough.
working. Well, it's not working for you. Like you're not using enough or you're not reapplying
Yeah.
it. And typically I tell people that the SPF on the bottle, like they should cut it in half immediately when they put it on because they're not putting enough on to get that SPF. So and so that's where
Sunscreen's
maybe
expensive, man. I mean, it's a lot.
using,
It's a lot of
I
money. You
know
know,
it
to
is
conserve your
expensive. That's
bottles.
why you have to find a sunscreen that you like that you can afford to use quite like often. Like I
Right.
actually buy, like I probably go through a bottle of just my facial sunscreen every single month. And I
Yeah.
have like 5 of them floating around. I never have sunscreen expire. Like maybe like the ones that my kids use, they expire, but I use sunscreen so frequently. And for my body, I typically don't depend on sunscreen, not for my neck and my chest. Like I like never expose them to the sun. Like
And
I just
remind
don't.
everyone, we live in Seattle, by the way. We're not like in
I know.
San Diego.
Yes.
But the indoor component, like we talked about before, is still a thing. Like now, you know, you're wearing clothes
Hmm.
inside, but it's like the blue light, like whatever's hitting your skin,
Yeah.
that's
Yeah.
visible. Yeah, that's still a thing. It
I
sounds like.
typically don't put sunscreen on my arms. Maybe I should during the day. I do put every single thing that I use for my skincare, I put on my neck and my chest too. So I put
Yeah,
my
because the neck
vitamin
ages,
C,
right?
like,
Like you're gonna see
oh
people
my
with like
gosh,
facelifts, but like it's their neck is
everybody.
telling a different story, right? Yeah.
Well, I mean, oftentimes when people have a facelift, the reason that they go get a facelift is because their neck. Lots of people come in, they're like, I just want my neck to be better. And so I use every single thing every step of my skincare routine, morning and night, I do on my neck and chest as well. And
That's a
your
big thing.
ears, you got to do your ears. I see lots of skin cancers on ears, lots
Ugh.
of them.
Oh my
Yeah.
gosh. All right. Everything's cancer.
Yeah.
Oh, that's the next one. Number 6. Is this cancer? That's a huge question on Reddit. Like they'll show like a blurry picture that they take on their crappy phone. Or actually, it's probably a good phone. They're just taking crappy pictures. You know, like you see these
Yeah.
like blurred up pictures. Like, is this cancer? Is this mole cancer? You probably
Why
get a
are
lot of
people
those.
putting this on Reddit? Like, why don't they
Oh,
put it
there's
on
everything on it.
ChatGPT? They should put it
It's
on
everything.
ChatGPT. I mean, maybe it might be
Yeah.
better though. I've not
Well,
tried
maybe,
it.
yeah.
I mean,
Right.
I get that. I mean, I get lots of people sending pictures of things on like our portal too and saying, is this cancer? I
Yeah.
mean, it's really hard to tell if something is cancer. Most of the
Right.
time when people come in, it's not, but I mean, there's a lot of growths that people get as they get older. So typically what I say, the most common sign of a skin cancer is a non-healing sore. So like a sore or a pimple, like a pimple or a sore in a sun exposed area that's not going away. And my rule of thumb is if you have something that's not healing after about 4 to 6 weeks, it should be looked at. So that's the
Right.
most common thing, the most common way that somebody will present with a skin cancer. And that would be usually something like a basal cell or squamous cell, which are the more sun related ones. Melanoma typically if somebody recognizes a melanoma, typically it's going to be a new or changing mole. But most melanomas that I diagnose, people have no idea that they had them.
Yeah.
So they didn't come in for that. So they
Yeah,
came in for something else.
a crossover thing with melanomas, not so much melanomas, but you see people like with that had old silver amalgam fillings over the
Hmm.
years, and they'll get these
Okay.
amalgam tattoos in their mucosa, and
Mm-hmm.
it's
Yep.
not a, you know, and people like will get biopsies for those. It's like it's likely from just some
Mm.
amalgam that got under the
Yeah.
mucosa there.
I
Still
mean,
biopsy, it comes back as foreign body, right? The other thing is melanoma in the mouth. I know is very rare. It's not zero, but
it's
it's
super
pretty
rare.
rare to get
Yeah.
it in the mouth.
It's super rare.
And more than
Yeah.
anything, it's just melanin pigment. Like if you biopsy it, you'll
Hmm.
get like just melanin pigment, not melanoma. You know, those are for the
Yeah.
intraoral biopsies
Yeah,
that we
I
get.
mean, I do some intraoral biopsies. I mean, a lot of times I see a lot of amalgam pigment. I mean, not a lot, 'cause there's not as much anymore, but I
Right.
can usually recognize it. I mean, like, this is probably amalgam pigment. We probably don't have to biopsy it, but if you want it biopsied, we can. And in some locations, I will actually biopsy it because patients, it's cheaper for them, especially ones that are. I see the amalgam pigment in people
Tattoos,
that have
yeah.
Medicare predominantly, and it's cheaper for them to have a biopsy done by a doctor than by a dentist. But maybe not you because you're
Yeah.
a doctor too. But like if it's at their dentist, they have to pay like thousands of dollars for it. So,
Right.
but if it's
No, yeah, you can
at
use your medical
with a
insurance and yeah.
if you can
Yeah.
use your medical insurance, then it's cheaper. So I actually do I do intraoral biopsies for people because it's going to cost them a lot less.
Yeah, that makes sense. That makes sense. Number 7, hyperpigmentation questions, acne scars even.
Mm,
Is
yeah.
that, are you thinking like brown spots? Like there's another crossover with that, huh?
Mm,
So tell me about
what's that?
tranexamic acid. Does that work on
Yeah.
skin?
So,
We use it a lot in our office, and I know a lot
yeah.
of dentist offices have tranexamic or they prescribe it. So what does it do for
Yeah.
dermatology?
So tranexamic acid it helps with pigment. So it could help with acne scars. So acne scars are usually like more of a red brown. So it's hard to say whether it would be good for that, but it's good for like melasma or just
Right.
sunspots, like sun aging. What it does is it lightens pigment. I would say that it as a topical, it's okay. I don't know if it's as good as hydroquinone or a new kid on the block called thiamidol, but it does okay. It can be prescribed orally and it does amazingly well. But when you take it orally, you have to be careful because it's something that makes you, it's an anti,
Well,
it's a
yeah, we use it
coagulant.
for,
So
yeah,
basically
we
it's a
use it
coagulant.
for,
So
exactly.
yeah,
Yeah, we use
it
it
makes you, it puts
for
you
patients
basically
with
in a
on blood thinners.
yeah, yeah. So it puts you, if you take it orally, you are in a hypercoagulable state. So you have to be careful that somebody doesn't already have risks for being hypercoagulable. So like they don't have a genetic tendency towards it. And you just have to also like counsel them and say like you are taking medication that puts you at risk for blood clot to make your skin look better cosmetically. So you have to be aware of, you just have to really make the patient aware. But that said, it does have very beautiful results. I don't typically prescribe it for more than 1 to 3 months, and it usually works really well over that time period. But you have close follow up with the patient and you put them on the smallest dose for the least amount of time. And usually it's for something that caused hyperpigmentation that they are committed to not having come back. So say somebody had a laser done that was inappropriate for their skin type or too high for their skin type. It's really good at taking away that pigment, or if they like say they have pigment that they want gone for an event like a wedding. It does it much more quickly than any topical, including topical
Interesting.
tranexamic acid. So, but I don't, but
That's cool to
it's a
know.
very,
Nobody, I don't think a lot of
it's a
people know
risky
this.
medication.
Yeah,
I
I
mean, I
agree.
think most dermatologists do. So yeah.
I mean, as much as we use it in the dental field, I mean, we don't really even talk about its derm benefits. So it's interesting to
Yeah.
me.
Well, I mean, you probably don't use it for long enough. You do have to use it for several weeks to a month to get the benefit.
Yeah, so let's see here. I'll skip through this one. People have questions. Let's just go through, I guess, number 10 here. Fungal versus bacterial skin issues. Like, is that a thing?
Oh
Is
my
like, I don't
God.
know.
Well, I mean, yes, but everybody thinks it's fungus. Like literally everybody comes in, they're like, I think it's fungus. Like I think it's fungus. Like nobody thinks it's bacterial actually. Everybody thinks it's fungus. They've all tried all the antifungal creams. Well, not all of them, but people think it's fungus and usually it's not. Sometimes it is. If it's on their feet, they don't think it's fungus and it usually is. I tell people like 50% of the men I see have fungus like baseline on their feet. Like they think that the dry skin on their feet is normal, but it's actually fungus. So if it's on their feet and they think it's fungus, they're usually right. If it's somewhere else and they think it's fungus, they're usually wrong. It's usually something else. And almost 100% of the time, people use the wrong over the counter antifungal medication for the fungus, whether it is or not. And they use Lotrimin. And Lotrimin does a very good job of advertising like a hot foot on the box so that people think that it's good for fungus, but it's really not very good. It's clotrimazole, which is better for yeast than it is for fungus. And so if you think you have a fungal infection, you should actually use Lamisil or terbinafine. And that's actually better than anything I can prescribe, except for oral Lamisil or terbinafine. But topical cream, Lamisil, terbinafine, it's the same thing, works very well for actual fungal infections. And if you have dry skin or like cracking between your toes or like little cuts between your toes, that is almost always fungus. And if you
Hmm.
use Lamisil or terbinafine for a month, you have to use it for a long time, it will work.
And these
But
are
if you use
topicals, right?
Lotrimin, yeah, yes. If you
Okay.
use Lotrimin, it won't work. So the whole fungus versus bacteria is a yes, and people always think it's fungus, and it's typically not unless it's on their feet, in which case it is usually fungus.
Are those old commercials with John Madden? I think step up to the mic, Micatin or something. I don't remember, something like that. Step up to the mic.
Meconazole. So meconazole
Yeah,
is, I don't think that, so any meconazole and clotrimazole are similar medications. And I don't, and they are okay for fungus. They don't work they're not that great. So
I use
there's
clotrimazole
better
troches
ones.
in the mouth for
That works
Canada.
really well because it's
Yeah,
for yeast.
yeah,
So
yeah.
if you have a yeast rash, so yeast rashes typically, well, they can be in the mouth. Like if you get a rash in your groin, like usually the groin rashes are yeast and not fungus. Sometimes there's a
Got it.
crossover there, but a lot of times that's yeast. Women get and people have, if you get a rash on your folds, under where skin touches
Right,
skin, so under the
right.
breasts, under the belly, under your armpits, that's oftentimes got a component of yeast. It's unlikely fungus, it's yeast. So the metronidazole or the clotrimazole will work well.
Got it.
But the armpit
Awesome.
rashes, the most common cause of armpit rashes is native deodorant. So
Interesting.
stop using,
Yeah,
yeah.
that's the thing. Yeah, you had mentioned like deodorants, like aluminum is usually fine and things like that. So I
Oh, it's
remember that
always
post
fine.
too.
Like it's not
Yeah,
like it's always fine. Like it's it's like aluminum, the aluminum part of antiperspirant is never the issue. It's always the other things in both deodorant and antiperspirant. And
yeah.
because the deodorants don't have the aluminum, they have a whole bunch of other things, and that's typically what causes people problems. The aluminum is
Awesome.
not a problem. That's
That's
a
what I
myth
thought
that's
too.
been debunked, but everybody still thinks that
They
aluminum is
use
dangerous. And
Tom's of Maine. I don't know, but
Tom's of Maine is okay. They have actually an okay antiperspirant that's pretty good for sensitive skin.
little Burt's Bees.
So
I don't know.
Burt's Bees, I don't think they have an
Yeah, I
antiperspirant,
don't
but
know.
their chapstick causes rashes in a lot of people. So
Interesting. So I
yeah.
had so much more stuff to get through. Like we didn't even get to like
Oh my gosh.
filler, bad filler,
Bad filler.
like perioral stuff. Like I was looking at
Mm,
that, even pemphigus vulgaris, lichen planus. Like there's so much crossover stuff that maybe we might have to do a part two down the line.
I
There's my
know.
cat again. But I was going to ask you a couple fun questions here at the end here. Let's see here.
Okay.
You're
Fun
you're a
questions.
yeah, you're a crazy like fitness person. Like you do you're up early, like working out even before work, and then after work you're doing stuff. Like when did you even start like getting into all this fitness routine for yourself? Like have you always been that way, or is it something like you've developed into?
And somebody asked me that actually at one of my classes who was quite a bit younger than I was. And I've always been, and I mean, I was in organized sports as like a child, like, and I played soccer for like, I was basically never did anything else other than sports. So I just did organized sports when I was in my youth, and I played college soccer, ran track, and then after college, just I had a period of time where I ran marathons, and now I'm too old for that. So I run shorter races, and I'm on the bandwagon of strength training because you lose muscle as you get older. So there are actually studies that show that strength training or resistance training actually releases growth factors into your bloodstream that helps your skin. So it helps your skin. So you should do weightlifting or resistance training. Doesn't have to be
Interesting.
heavy weights, but resistance training helps your skin. And one of the biggest sort of indicators of longevity is your VO2 max. So keeping your sort of ability to work your lungs hard is actually like an indicator of like long-term health. Yeah, I just want to kind of, I don't want to, I mean, I'm definitely way slower than I was like 20 years ago. But I don't know, just keep it on going.
That's awesome. I have to find my
So
incentives barometer. I think I have one somewhere. Um,
yeah.
so I was going to ask you here, like for Amazon Cosmetics, I know you mentioned like stuff
Mm,
you buy, and I know you're not affiliated with anything. You don't get paid by these people, which is
no, huh?
great because you can recommend
Yeah.
whatever the hell you
Yeah.
want.
Yep.
Moisturizers, like Dermatology, you mentioned. Do they make the moisturizer that you like? I'm sure there's so many different brands, but
Yeah, so I mean, I have lots of different brands I like. The moisturizer, my moisturizers that I currently am using are the Dr. Rogers, and she's actually
okay,
a local dermatologist. She has a great
very
skincare line,
interesting.
but I
All right,
really like her moisturizing cream. It's very hydrating. I have kind of aged skin, so I use a heavier moisturizer. I also like the Sente brand. But I do buy, you have to be careful when you buy things on Amazon. I buy tons of stuff on Amazon, but they have
Yeah.
recently introduced a sort of in the, like, when you're buying it, it says sourced from someone who is from sourced from the actual manufacturer. So basically you can tell whether this product is real. So they're saying we have sourced this from someone who is
Oh,
authorized to
I
sell
never
it
even
or
seen
from
that.
the directly from the manufacturer. This is mostly for things that are expensive. So
Right.
it basically tells you whether they are an authorized retailer for the product. Like, can Amazon sell it? Do we get this directly from, like, Dr. Rogers sends their products directly to Amazon and Amazon sends them to you. Now you can
Okay.
get them from her website or you can get them at Nordstrom. The dermatology products are the same. You can get those from the dermatology website. You can get them at Ulta. You can get them from Amazon and they are an authorized retailer. But
Got
if
it.
the product does not say that it's not an authorized retailer or it's sourced from someone who is, then I don't usually recommend getting skincare that's like boutique skincare. So like expensive skincare. Now, things that you could get at Walgreens, like Cetaphil, CeraVe, La Roche-Posay, things you can get at Costco. That's kind of a running joke in our clinic because everybody says, "Can I get it at Costco?" If I recommend something, they're like, "Can I get that at Costco?" I'm like, "Yes, you
I
can
heard
get like
oil
if
of Olay was actually not bad. Is that true?
it's not terrible. No, I mean it's been around
Oh, yeah.
forever. My mom
I know.
used oil of Olay. Her skin looks great. Like it's been around forever. They have updated products. You can get them on Amazon. You can get that at Costco. I mean, you just have to know. I mean, they just have every line has different products, and you just have to know what you're using. Like, are you using the oil of Olay moisturizer? Are you using the sunscreen? Are you using the retinol? Just kind of know what's in your skincare product.
Yeah. Last couple questions here. What's your
Okay.
you like music? So like, so what are the like the best two concerts you've probably been to the last few years?
Oh my gosh. Well, that is so hard. I've been to so
Just
many that
two.
are so good.
I know. Just give me two.
How can I pick two? The last few years. Okay, so the best two. Okay, so Taylor Swift
Okay.
I saw Taylor Swift at Wembley Stadium in London, and
Whoa.
that was
Cool.
amazing. I saw her in Seattle too, but I saw her
Yeah.
that was in 2 years. So I did see her in 2024. We're not to the 2 year mark at Wembley Stadium. That was amazing. The other one that is amazing. I am a huge country music fan, and so I saw George Strait and Chris Stapleton when they came to Seattle,
Nice.
and that's probably the other one that was amazing. And George Strait was like the main act, and Chris Stapleton was the opener.
Yeah.
So that was a good one. But I
I heard
do see a lot.
Stapleton's cover of The Gambler. The Gambler is like one of my favorite songs by Kenny Rogers,
Yeah,
but
no,
he did a
no, I love.
cover of it recently. I saw that was pretty cool. Well, that's it. Like we don't have time for the
All
rest of the
right.
stuff. Maybe we'll do a part two down
No.
the line because there's so much content
Gotta
that I
do
didn't
part
get
two.
to.
See if this hits. I mean, like I
It'll
might
be
be
good.
not very popular because
No,
I
it'll
don't
be good.
know. I'm wearing scrubs and like
That's
sometimes that's
fine.
not a popular thing. So I don't know.
It's totally fine. Thanks again, Aaron.
We'll
I
see how
really
it goes.
appreciate it.
All right. Thanks, Serv.